Good afternoon, everyone. Welcome to the Performance Driven Academy. We have a wonderful webinar lined up for you today. If you're just joining us, if you could navigate over to the chat panel and click on the link to fill out our very brief couple of questions survey about whether the last webinar and the tools we provided were helpful to you, we would very much appreciate it. Today we are talking about practice development and management, and we have some exciting tools to share with you. I am Brianna O'Connor. I am from CCSI Center for Collaboration in Community Health. We are the upstate New York partner for the Managed Care Technical Assistance Center, who's bringing you this webinar series, and this is the entire Performance Driven Academy. MCTAC is made up of McSilver Institute for Poverty Policy and Research, and the National Center on Addiction and Substance Abuse. A couple of housekeeping items upcoming after this webinar. This is our last webinar in semester one. After this, we have our in-person sessions in June. They are already scheduled. The dates are at the end of this webinar. I believe you received an email with the slides and also the tool for today that you can be playing around with. And we are asking that every individual person who's attending one of those in-person sessions register, so we know how many lunches to buy and how many coffees to plan. We will be sending you shortly a link to an end of semester evaluation. This is sort of the follow-up from the baseline survey that you may have completed. If you did complete the baseline and you complete the end of semester, we'll be able to provide you a report about progress or changes. If you did not complete the baseline and you do complete the end of semester evaluation, it's still very much appreciated, because wrapped in there, in addition to any changes that you noticed within your organization, will also be feedback about this experience and what we can do for you in the future, what else you might need support with, or what didn't work out as well for you. Semester 2 starts in July. You'll receive additional information about that via email as well. Most organizations who signed up for semester 1 signed up for semester 2, so you're probably already registered. If you do have any questions about that, feel free to email PDA@ccsi.org. You can always email there directly for any questions or comments about this series. These webinars, the materials are all recorded. They'll be up on the website soon. You probably received an email that the website's having some technical difficulties, but you should have gotten a personal email from PDA@ccsi.org with the content. If you did not, please shoot us an email. We'll send it over to you now. If at any time during this webinar you have any questions, comments, chat them into all panelists. At any time that you have questions, and we've planned to save a few minutes at the end to address as many of those questions as we get to. So we usually like to just talk a little bit about what the PDA is and orient you to what we're doing here. So this is our large graphic of what components are required to make a performance-driven organization. Today we're talking about the process piece of practice development and management, and that's just one of those processes that's required to really keep an organization moving. It goes along with the human resources component. We're really talking about what are the people that are coming to the organization doing, what are the people who work at the organization doing, and how do those work together to really drive performance. As usual, we also like to remind you that we're hoping that the series is providing your organization with a lot of concrete benefits through your participation. You'll be able to really understand the cost, quality, and impact in that broader system of care. Hopefully the tool that we're providing for you today, one of the tools we're providing for you today, will really help you be able to quantify that in a really meaningful way. Through participating in all of the steps of the PDA, you should have kind of a solid work plan of areas you want to prioritize for integrating some of this information within your organization. We do have, as I've mentioned, a couple of additional tools and resources today. We also have content experts specifically on practice development and cultural competence that I will be introducing in a moment to provide that aspect of the performance-driven culture. And as I mentioned, with the end of semester evaluation, we should be able to provide you with a report about your agency's improvement and growth through participating in this. What we have covered so far in the PDA, so as I said, this is the last webinar in semester 1. We have talked about everything from developing a culture that really supports performance-driven best practices and data-driven decision-making, how to implement effective collaboration, both internal and external, to really optimize impact. We talked about best practices to support those human resources and really think about accountability for performance. We've also worked through effective measurement practices. What are some basic best practices? What are some tools? What are some things to keep in mind to really make sure that you're using valid and reliable data to drive those decisions? And then our last webinar also focused specifically on continuous quality improvement as a tool to really drive some of that change and make actionable some of that information that you've been gathering. Where we're going is today we are at Flag 6, Practice Development and Management. After this, we have the in-person sessions in June, where we'll be kind of taking a deeper dive into some of this content and also providing additional tools, additional focus, and additional work opportunities within your work group to really think about how you measure your impact, how you define it, how you line it up with state priorities, and how you develop your practice as a whole. Then we move on to semester 2, where we'll cover a lot more in detail about finance and revenue cycle management, and also leadership practices and population health level approaches. So with that, I will gladly hand over the microphone to Nancy Sung-Shelton, who is a senior consultant here at CCSI in the Cultural Competence and Health Literacy Division, and she will be talking today about practice development and management. So welcome, Nancy.
Thank you, Brennan. It's a pleasure to be with you and all that are listening in today. We're going to talk a little bit about the background of me. I forgot about this slide. So my background includes a true and authentic mission to be a benefit in the lives of the people that I want to help, and I have a diverse experience working in multiple systems, and have taken all of that experience and compiled it into who I am as a consultant here at CCSI as we address cultural competence and health literacy for a multitude of organizations that include healthcare organizations down to community-based and other systems as well. And I like to share, because I am a cultural competence person, who I am as a cultural being. And so my top 5 attributes is that I'm creative, enthusiastic, people-focused, observant, and an influencer. Today's learning objectives is that we're going to consider how to understand the customer. We're going to talk about how to integrate cultural needs and data into performance-driven practices. And then later, we'll be introducing the data visualization tool to support the practice management and outcome monitoring. And then we'll hear from providers in attendance about how they think that culture intersects with performance-driven approaches. So this is a wonderful infographic. We hear cultural competence, and cultural competence is a compilation of many, many concepts and theories. Simply put, cultural competence means to be respectful and responsive to the health beliefs and practices, essentially paying close attention to the cultural and linguistic needs of diverse populations. We must understand that cultural competence is an evolutionary process, it's a dynamic process, and it takes time and occurs along a cultural competence continuum, starting from cultural destructiveness all the way up to cultural proficiency. Some things you want to consider as we talk about cultural competence as it relates to how you roll your services out. That uncommon service is not born from attitude and effort alone. It comes from design choices that we incorporate into the blueprint of our business model. So a lot of times as we're putting together our mission statements, which is often our North Star and how we want to present ourselves to potential individuals in the community and stakeholders, we like to say things like, we provide great service, we ensure that all customers have a great outcome, we serve the world, which are wonderful and lofty concepts and notions, but how do we put that into practice? We can use cultural competence as a guiding tool in order to achieve that, because as you can see in the diagram, cultural competence includes formalizing policy structures, practices and behaviors, and attitudes to operationalize cultural competence to meet the needs of the populations in which you serve. Why a performance-driven organization? Well, at the end of the day, it's to benefit the customer. Who is your customer? Well, if you understand very well, we all know that the first customer, which is often overlooked, is our workforce and staff. That is our internal customer. Our external customer are those who come to us for services, whether they're receiving direct care, and it includes collaborative and partnership type relationships. So if you want to position yourself to be an outstanding healthcare service organization, you want to design a model that allows for that great customer experience as an everyday routine. A lot of times we measure that through customer satisfaction surveys. We're asking and suggesting that you take it beyond satisfaction and move it to experience. We want to know what caused that level of satisfaction or dissatisfaction, because that's where the magic happens. And once we understand what the experience was, we can create offerings, establish and identify funding strategies to support activities to address those shortcomings or those dissatisfaction, or even to continue and grow those areas of satisfaction. We can create systems to support those activities, and in the end, we create a culture that supports your diverse employees to excel in meeting the needs of the service population. So Brianna showed you earlier this diagram regarding what a performance-driven organization looks like, and we understand that there are some essential functions within this model that includes IT systems and staff that are adequately trained and educated. And a lot of times when you talk about cultural competence, individuals and organizations think that it's simply training and education. As I mentioned previously, it is an evolutionary process that has multiple steps beyond training and education. And I'm sure that you all can assert to the fact that we invest money in training our workforce. However, we often don't do a good job helping that staff member translate that new knowledge into how they practice as a professional. And what we also need to recognize and understand that we can develop great strategy, but culture supersedes strategy in every instance. And if we don't properly consider the culture of the organization, the individuals who are employed by the organization, and the culture of the individuals being served, we can cancel out those well-drafted strategies. So what do we need to think about and make sure we have our focus on in this effort to create a performance-driven organization? It's the people, our internal customers and our external customers. How do we know our customers? Well, it's by collecting data. And I know that you all are inundated with so many multitudes of expectations regarding what data needs to be collected. We also understand there are some limitations associated with that data collection. However, we're still going to present to you in a resolute voice that data provides us an avenue to know those who we serve and those who, the staff, provide the services to our clients. So collecting the data on our clients, but we also need to collect data on our staff. It supports the wise use of the limited resources, so you know where resources and energy needs to be allocated. It encourages informed decision-making, so you know what's happening and who it's happening to, so that you can tailor your service delivery and your infrastructure to support those individuals. It heightens your accountability to make a difference and impact. And it is important in supporting a more certain future during uncertain times. It enables you to really, really project into the future and identify any potential emerging trends. What are some data that you want to consider collecting? You want to take it down to a granular level in reference to ethnicity. So beyond just black, white, Asian, you want to maybe even take it down to when you think about the Latino population, who comprises the Latino population, because it's a very different conversation to be Puerto Rican and to be Cuban. And if you recognize that you have a heavy Latino population in your service region, you want to know which cultural group under that heading is in your area so that you can speak to their specific cultural needs. You can also collect preferred language. And sometimes we make the assumption that the person speaks English well, and we just assume that that's the language they prefer to be having their service conducted in. However, the best way to note what language they are effective and adept in communicating in is asking them what language is spoken at home. The sexual orientation, their sexual identity, their gender identity. That's an emerging conversation that's coming out and more prevalent in our community as it relates to the LGBT community, the communities in which our clients live, work, and play. We want to know where are they situated and how do they function in that environment. So we will need to understand some of those social determinants of health, in which we'll talk about on the next slide. So what is the what else? These are some suggested broadened areas in which you may want to consider to collect regarding your consumer and patients to kind of get a better, clearer, more comprehensive view as to who they are as a patient, who they are as a person. So you have what we pretty much all capture: the age, the language. Maybe we're also asking if they require some interpretive services, their gender identity, their sexual orientation. And here we have a little bit more deeper dive into the granular level about some of the things that happens in their life. What are their spirituality beliefs? What is their religion? What is the level of coverage, their educational level, complementary alternative medicine use. We may not think to ask that question, but we need to know that, because if they feel that that is a method that works for them and we neglect to include that into how we conduct our service, we could be missing the opportunity to engage them and also prohibiting their own health and wellness through their own perspective. So we want to make sure we have that conversation. And also, furthermore, some of the complementary alternative medicine may not correspond or work well with the treatment approach that you're going to be presenting to them. We want to think about their beliefs and practices, because we understand that patients don't get well in the doctor's office. They get well in their respective communities. So here's a very poignant statement. The presence of data on race, ethnicity, language preferences, and social determinants of health does not in and of itself guarantee subsequent action in terms of analysis of quality of care data to identify disparities or actions to reduce or eliminate disparities that are found. So we recognize and understand that, but we know that when we don't have the data, it guarantees that none of these actions will occur. So some considerations in providing culturally responsive care in a PDA. So you want to assess the organization's level of cultural competence. What are your strengths? What are your assets? What are the areas for improvement? You want to recognize and promote best clinical and administrative practices from a culturally responsive perspective. And you want to identify some of those hidden, maybe that cross-cultural resources and talents that may need to be revealed that currently exist within your workforce. You assess the staff's level of cultural competence and their understanding and acceptance of how this relates to the person's traumatic experiences. You want to also look at the patient assessment through a culturally informed lens, and you want to view engagement and treatment and through a culturally informed lens as well. So I have a polling question, and if you all could just respond to this, and then we can kind of see where you all are placed in this particular question. So the question is, does your organization have a plan for incorporating cultural competence into service delivery?
You should see a poll question in the chat area on the right where it says polling.
I'll give you a few more seconds, and then I would like to respond to what I see here. So what I'm seeing is that several of you have incorporated cultural competence into your service delivery, but it's still very unclear. And that's quite understandable, because as I mentioned previously, that cultural competence is an evolutionary process. It's a journey and not a destination. So if you found yourself as an organization where you are feeling confident that you have arrived, then you are stunting your own progress and moving forward and able to be responsive to the emerging trends being presented in your service region. So the uncertainty, the fact that it's unclear, and even those who find it to be clearly defined, some people are quite challenged on how to take that incorporation and monitor its success and move it to the next level in the continuum. So this is a process in which our team here at CCSI has developed to assist organizations with transforming their organization into a culturally competent space. And I'm going to describe and introduce to you some of the elements in the tool that we utilize to help ascertain your baseline at this moment in time and where you are as an organization as it relates to cultural competence. So the different areas within the tool is the needs. We talk about needs assessment, information exchange, the services that you provide, human resources, policies and procedures, and then outcomes. So the first area is needs assessment, and it refers to the baseline of information about profiling the groups within the population of focus. So we're speaking to understanding and obtaining global information and cultural information regarding who it is that you're intending to work with and who it is that's showing up in your service region. So you want to have that comprehensive knowledge so that you can be able to tailor the services to meet their needs. Some information that you would like to collect is the population size of different cultural groups within the service area, demographic characteristics, socioeconomic status, language requirements, and literacy levels. So for example, language requirements. You may live in a city like Rochester that is considered a sanctuary city, which means that we're welcoming of new immigrants and new Americans into our space. And so with those individuals that come from other countries comes a language. And if you're collecting data on the emerging cultural groups that's coming into the service region, you can position yourself as an organization to meet their language requirements and needs. As well as literacy levels, it's important to know how people comprehend and access information, and how do you address their linguistic needs as well as their health literacy needs. So you will be able to identify the preferences of those groups so that you can plan and develop culturally competent service approaches. Here is another polling question. Are the cultural attributes of the individuals in the community that the organization serves included in the organization's information system? And if you have time available, quickly, list some of the cultural groups who reside in your service area, how much of the overall population it represents. And I will offer this disclaimer. When we ask that second question to providers that we work with, most people don't know that information. So I would just like to see if you have any cultural groups that you see in your service population that you have identified. Okay, we're going to keep it open for a little bit more so you guys have some more time to write, but I will respond to the fact is that a lot of times folks do collect data. Sometimes it's incomplete data. There are some certain attributes and nuances that aren't collected, and a lot of people are challenged because of the system limitations, being able to customize their data collection tools to incorporate those other nuances that weren't standardized in the tool. So we're just suggesting that you create ways and methods in which you are able to collect that information, because it is critical information that, if left unaddressed, can really prohibit your patient engagement. So what are some of the cultural attributes that you would like to consider? Beyond the first column is which we pretty much typically collect, which speaks to identity as a cultural attribute. You want to collect some language and literacy. What is their English proficiency, their preferred language, some of the dialects, and one of the ones that I think a lot of times is overlooked is the colloquial and vernaculars that are spoken by individuals. So what is your common language? And utilizing that understanding to inform how you interact with the people you serve, whether it's an internal or external customer. And you also want to consider the origin, and then, as I mentioned previously, the social determinants of health. The next area in the tool that is discussed is information exchange. It speaks to the two-way communication that happens between the organization and the community it serves. It also includes information in areas such as prevention, stigma reduction, service planning, and benefits and rights of adults, children, and their families. Some questions to consider in this particular area are in order to understand who you're serving and how to best serve them based on their lifestyle and their home environment situation. You want to know in your region and amongst the population issues, or what are the unemployment rates, what are the income differentials, the death rates, the crime rates, poverty levels, homelessness, food security. And when we talk about trauma-informed care, these are some things that you definitely want to know about, because people are coming through your doors with these issues that they're contending with, and it can compound or add a complexity to how they access service and how they interact with you, as well speaking to your internal customers, your staff members. If they are coming from communities that have these issues prevalent in their living environment, it will be an impediment in their ability to serve you well as an employee, because they're distracted, they're overwhelmed, they're stressed out, and you want to know that so that you can meet their specific needs and support them in their development as a staff member and support them in their growth as a professional. So here is another polling question, 3 of them. Are you able to describe the social problems of the cultural groups in your service area? Are you able to describe the cultural strengths of the community? Have you included in your management information system the vulnerable populations in your service area? So as I mentioned previously, it is very important to understand those social problems and challenges that are existent within those cultural groups so that you can properly and adequately address them, and also use that information to inform how you engage with your staff members as well as your service population. And as well, you want to know what the cultural strengths of the community are and what are those assets present in those communities, so that you can maybe determine to establish a strategic partnership with those strengths and assets, because they can inform you as cultural brokers on how to access those peripheral cultural groups who we are all challenged with interacting with. And they also can give you some more information regarding how to best engage and interact with those cultural groups. And then have you included in your management information system the vulnerable populations. You want to identify who the vulnerable populations are in your service area, and then begin to keep a laser-focused view on those groups, because those groups are the ones that are experiencing the highest rates of healthcare disparities and complex inequities within our system. The next area of the organizational assessment are services. So we want to look and view and begin to analyze the activities offered and performed, which include the following: accessing service comprehensive assessments utilized with our service population, the development and implementation of service plans, transition planning, self-help, self-empowerment, and shared decision-making. A lot of times, you know, as we function as professionals, as we engage others, we have a lot of credentials, a lot of experience, and a lot of education to help us make good decisions on behalf of folks. I can speak from the perspective of the customer, the external customer. We want to be able to have exert our human right to bring to fruition our own definition of success. So that shared decision making is critical in incorporating that voice into their own self-determination through self-help and self-empowerment. So services must be culturally relevant, appropriate, and trauma-informed to meet those needs. Some questions you may want to consider when you're looking at your services. Are you familiar with the limitations of the mainstream tools that are utilized? What we know is a lot of the mainstream tools, when we talk about evidence-based tools, a lot of times they have not been adapted or validated for a lot of those vulnerable populations. And so cultural competence, if you want to talk about anything that's contrary to cultural competence, it's the cookie-cutter approach. So we want to make sure that we identify these tools that speak and resonate to those groups that are not necessarily identified as mainstream. Do you assess the client's level of acculturation or assimilation with respect to mainstream? And it's critically important to understand the difference between acculturation and assimilation. And so that you are not having to have someone conform to be the way that you think they need to be as they insert themselves into this mainstream culture. And through acculturation, they're able to retain critical elements of who they are as a cultural being as they intersect with the mainstream culture. Do you use historical references in the assessment and planning of services? Some historical trauma has occurred for a lot of our vulnerable populations, and if you don't consider that, you might find yourself in a space where you're not prepared to have critical conversation, and you may not understand why a person is behaving the way they are, the apprehension, or it may just be distrust because of that historical implication. Do you use ethnographic interviewing techniques to gather more accurate information? That just requires a great level of curiosity and a willingness and vulnerability to express and realize that you don't know what you don't know and that the person in front of you is the expert on themselves. Do you advocate for quality of life issues? Going back again to those other compounding issues that occur in the communities that present as impediments or barriers to health and wellness, and you want to know what those are, and then once you know what they are, you want to be a part of the conversation to eradicate those potential unsavory things in our community. Do you use customer feedback to evaluate service delivery? Are you talking to them and finding out, was this effective? Did you like it? How was it effective? So again, going back to that experience conversation. The next area is human resources and organizational policies and procedures. So human resources refers to the management of all employees at all levels, and that we want to make sure as part of our experience of helping and supporting and managing our staff that we are aware of their own traumatic stress and who they are as cultural beings. They have the training and experience to work with those cultural groups, and oftentimes that training experience has to be speaking to cross-cultural interaction in their service area and are willing to incorporate their understanding, their awareness, and their empathy to address those clients' cultural nuances and how they work with the individuals they intend to help. You want to formalize cultural competence in your organization through policies, procedures, and plans. Because we know that if you don't have it in a policy or procedure or plan, first of all, it may occur in a segmented, informal way throughout the organization, and if it's a good thing happening in one department, you want to formalize it so that it happens across the organization. And that you also, part of that process, once it becomes a policy, it also becomes part of the staff evaluation, supervision, and performance, annual performance review. You want to devise mechanisms that require that specific tasks and procedures be conducted to facilitate the organization becoming a culturally competent organization and also supporting those behaviors. And you want to review those class standards, which are the culturally linguistic appropriate services standards, and you want to make sure you're reviewing the ones that's classified as being enhanced, because that's the most updated version of the class standards. Some questions to consider in reference to this area are there cultural groups from your service area represented on your staff? I mean, ideally, best practice is that your staff represents the service population. So, for example, if you recognize that 10% of your service population is Latino, then you would want to have 10% of your staff represented and identifying as Latino. It just helps, because even though we recognize there may be a limited pool of qualified applicants in certain cultural groups, and we will have to support cross-cultural engagement and trainings to support that type of engagement. It's just ideal to be able to sit in front of a person who looks like you, behaves like you, and understands intimately who you are and what motivates you as an individual. The next question is, does your organization prepare new staff to work with these groups? Does your organization emphasize active recruitment so that you have a formalized HR recruitment policy that you're trying to diversify your staff? And it's not just diversify your staff from a high level. You may want to think about strategic recruitment for certain levels within the organization, from leadership down to direct care. Does your organization staff routinely discuss barriers? That could be part of the supervision, where the supervisor discusses some of those barriers, or as a team meeting, so that you all can concertedly work to identify processes and strategies to address those barriers. And does your organization staff routinely share success? I mean, I think we don't celebrate our success enough because we're so engrossed in the work that has to happen, but there are so many lessons that can come out of those success stories, and we can teach each other on how we also can all enjoy success from the efforts of one individual. Some additional questions to consider as a matter of policy: does your organization provide or facilitate child care for community meetings? Do you use natural helpers or extended family members to conduct outreach? Do you translate your documents in other languages? Do you have cultural competence reflected in your job descriptions? And is cultural competence reflected in your organization's performance appraisal? The next area of the tool are outcomes. And so we've talked about outcomes as evidenced by positive change, improved social functioning, recovery, and self-empowerment. And what we know is that outcomes for any one cultural group should be consistent with the outcomes for the entire population served by the organization. Everybody should have a high rate of satisfaction, a high rate of positive experience, and a high rate of desired outcomes. Everybody should have access to that. Attention should be paid to measures such as high dropout rates and no-show rates as potential indicatives that services may not be culturally relevant. So if you notice that you have a high dropout rate among the African American individuals in your service population, you need to kind of do a deeper dive to determine why are we experiencing that. It tells a story. Especially when you do it as a side-by-side comparison to the other groups that are also accessing services. To better explain that, in the next slide, we are going to talk about the difference between equality versus equity. So what you see illustrated here in the first image, you see three individuals, one very tall individual, one medium-sized individual, and one very, very short individual. Those boxes are illustrating what equality looks like. That means everybody gets the same thing. And a lot of times we say that in our approaches to provide services to the patients and consumers and even our staff members in which we work with. We're giving everybody the same opportunity. And you can see what's happening here, that the same opportunity does not provide the same outcome. What does equity look like? Equity basically means everybody gets what they need. So you see that the shorter statured and the medium-sized statured person are getting what they need to access the same outcome. They all want to see the game. And so now we have created supports to meet their specific needs. They are being treated equitably. In the end, this is the utopic version of everything that we want to create for ourselves, is where you don't even need any supports or accommodations because of the inequity was addressed, and then the systemic barrier has been removed. There's no longer a picket fence that prohibits the view. There is a different fence that still protects them, but everybody can see without having to need any boxes or supports. Some questions to consider in this area: do you collect program level data on cultural user groups? Is your outcome data analyzed and summarized for the cultural groups within your programs? Is the data that you collect at the program level used to evaluate the appropriateness of the services to cultural groups? Do you administer a staff experience survey? Do you collect demographic information in that survey? And do you collect demographic information in the external customer, your client consumer experience surveys? Effective care, respect, and make every effort to understand and be responsive to cultural differences, recognize the unique cultural background of each family, address proactively the disparities in access, appropriate services, and equitable outcomes. The key word there is proactively, and in order for you to position yourself as an organization to be proactive, it means that you would have conducted all the activities that I've mentioned, your needs assessment, your understanding of your HR, your understanding and formalizing cultural competence through policies and procedures, and just really knowing how you transmit information to and from the organization with the service region and population. Once you have collected all of that information, you know how to address disparities in a proactive fashion as opposed to dealing with it after it has already occurred and festered and caused contention within your organization. The more we know about our customer and their cultural nuances, it puts us in a better position to design supports and services that will meet their specific needs, give them a great customer experience, and achieve positive outcomes. The best illustration example that I can give you is the difference between buying a suit or a dress off of the rack or having one tailor-made for you. So consider the fit and feel and how you feel when you have a suit that's made specifically for you. It accents the beauty of who you are as a person and brings out your very best self. So we want to make sure that we are tailoring suits and dresses for our consumers and our patients so that they can enjoy that same positive outcome. William Osler says, it is much more important to know what sort of a patient has a disease than what sort of a disease a patient has. So it's just perspective, and we want to focus on that the patient is a person that is a cultural being, a person that lives and functions in an environment that can support or impose on their health and wellness and their personal desired outcomes. But we have to recognize that the person is not their disease, their circumstance, their situation, their problem. They are an individual. Our greatest strength as a human race is our ability to acknowledge our differences. Our greatest weakness is our failure to embrace them. Yes, we are all very much the same, and we're all very much the difference, and that's where the magic happens. And quite frankly, if the world was full of people just like me, as delightful as I am, it would be rather boring. So we want to make sure that we understand and acknowledge those differences and also embrace them. So in reference to practice, acknowledging dimensions of diversity, differences of opinion, or someone's feeling is a good first step. Is it sufficient? Is it enough? Today, I swear it requires of me to not only acknowledge someone whose reality is outside of my realm of my own experience, but to have the capacity to embrace them such that they feel seen, heard, accepted, and met. So where's a good place to start? The best place to start is at the beginning, I guess. That makes sense to me. So you can begin by completing a cultural competence and health literacy assessment of your organization, as I described to you in this PowerPoint. And if you're interested in having a deeper conversation in reference to that tool, it's a web-based tool. You can reach out to me, Nancy Shelton, and we can have a follow-up conversation regarding accessing that tool and discussing further the process and how to bring that tool to life within your organization. You need to be intellectually honest with what's working and what's not working, and I love that it's called intellectually honest, so you're not admonishing yourself for the things that you've done well, done wrong or bad. You are just being honest that this is an opportunity for us to do better. I think there was a person in the community that used to say, I'm sorry, I just totally forgot my train of thought. I apologize about that. But you just need to be intellectually honest with what's working and try to figure out what you need to do to improve that. You can do that by obtaining feedback from those who you are working with and identifying those that you may not have given your concerted view and they have an opinion to offer that could be helpful as well. You want to identify what information is missing. Is there something that you can measure but haven't done so? Is there something you are already measuring but not factoring into your decisions? And are there resources you are taking for granted? And what I was just trying to say about intellectually honest, it's a person in the community that says, good, better, best. I can't rest until good gets better and better gets best. So how do you design your equation for your organization? What will be your equation for success? What are some of the elements in your equation? Some elements you want to consider is a commitment from your leadership to make cultural competence and health literacy a guiding principle of the organization. You can include it in your mission statement, your vision statement, your protocols, your policies, your procedures. You just want to have a commitment from your executive leadership that they take this very seriously and they want to incorporate it into how they conduct business. You want to have a cultural competence and health literacy champion. You want somebody who's going to be the one that's going to be accountable and also be the cheerleader for making sure that this happens and the touch person to ensure its success, and also identify some of the resources that may need to be put in place in a formal way to support the activities, and that happens through a budget. The champion also will need to have access to a committee to support them in the work, because we know several heads in one room can come up with some amazing things, and you don't want to have the burden on one person. It's not a job. Cultural competence and health literacy as an organizational initiative is not a one-person thing. It requires a collective. And you want to be able, you can utilize the cultural competence and health literacy organizational assessment to view your organization from every aspect. You want to, it helps you to explore your strengths and your improvements, your human resources, your information technology, the training and education that's required to support your staff and workforce, and then also incorporating continuous quality improvement to make sure that you are producing your very best self in every instance. Here is Lenora, and here is me. Lenora is, she is the Director of Cultural and Diversity Initiatives, and she is a phenomenal leader and expert in cultural competence. And she's here with me in spirit.
Well, I would like to thank you, Nancy. I think this was an excellent presentation, and I'm hoping that folks are thinking about questions and chatting them in. I have a few more minutes that I'm going to take your attention to show you the tool that we have to support some of these really critical points that Nancy was talking about in terms of really looking at a lot of different types of information and how that's a first step, but a necessary first step. So while I'm speaking, please feel free to chat to all panelists, any questions or comments that you have for Nancy or about the tool that I'm about to show you. So at a webinar, 2 webinars ago, I believe, we rolled out, just so you had access to it quickly, a version 1 of this tool. What we've been able to do is to update this Excel tool at the workbook where you can enter information. There's some simple instructions that walk you through what you're looking at and why you're looking at it, and then it provides a really rich series of auto-populated visualizations and demographic filters that you can customize. So a lot of the cultural attributes that Nancy was describing, really getting down to that granular ethnicity, understanding of a subpopulation or a population of interest, understanding folks' social identities, you can really customize this tool to meet the needs of the population that you serve. The tool is currently set up to answer some of these key questions. So you're able to look at a particular outcome and see if there are differences by the primary types of services individuals are receiving, the primary diagnosis or presenting concern that they come in with, by some demographics, gender, age, race, ethnicity, and then of course you can customize that to include those social determinants of health or community characteristics as Nancy was describing. The tool also allows you to look at whether there are differences in who's using the services based on some of those same types of characteristics. And then, of course, it has a demographics page where you can look at the distribution of the population served by some key characteristics and demographic pieces of information. There's also a finance tab in the tool currently that is functional and allows you to use it right now, but it will also be updated in semester 2 as we get further into the financial work there. A couple of screenshots just to give you an idea of what's inside the tool and how you can understand it. It's essentially plug and play if you need it right now to enter data and look at the filters, and there's instructions for how to use it. As I said, though, it's not locked, so it's customizable. So if you have someone in your shop who has a little bit of Excel knowledge or a little bit of interest in Googling some Excel, how to update some of these fields, they could probably take it and run with it and really make it very valuable to your organization. At the in-person events in June, we'll send an email out about this as well, but at the in-person in June, we'll also have the opportunity for you or your staff member to come with your laptop and sit down with someone who created this tool and really talk about how to customize and how to make the most of this tool. But what you're looking at are some of the auto-populated tables and figures that come from someone entering a roster, for example, for their program. That's on the left, and there's a series of those if you scroll down. You should have received this in your email earlier today, so if you didn't, please let us know at pda@ccsi.org. And then on the right, you see those interactive filter features. So there you can click on a number of different features of characteristics and see what this looks like if you wanted to look for a specific subpopulation, which probably makes a little more sense for an outcome view. So this is one of the views of the outcomes. So we're looking at progress on severity of symptoms from baseline to whatever our most recent review is. You can set that up in a way that works for your organization. And the options are ranging from significantly worse to no change to significantly improved. And on the top screenshot, you can see that's the distribution for everyone served in this particular program. But then with just a couple of clicks, if I want to know what the outcome looked like for example, for my Black or African American male population, I click on those two filters, and I can see that there's a difference there that I might want to probe. So the bottom is just showing you that once you do select the filters, you're only looking at the population of interest there. Those are the filters that are customizable. So if you are more advanced at this and you're already looking at some of these features and you want to take full advantage of some of the description that Nancy had around those really more granular elements of someone's social determinants of health, their social identity, their cultural attributes, you can modify this tool to look at it in those ways as well. So that tool is available to you. As I said, you've been emailed it. When we're able to update the CTAC website after their technical issue is resolved, it'll be up for you there as well. What to do next from this webinar? Here are our takeaways that we suggest that you might do to continue moving this forward between now and the next time we meet in the in-person sessions. So certainly we recommend that you meet with your work group. Within your work group, start discussing how you can reevaluate your understanding of both your internal and external customers to inform what those improvements or enhancements might be of your current service delivery and organizational structure. If you are interested in the Cultural Competence and Health Literacy Organizational Assessment Tool, feel free to reach out to Nancy and she will give you some information about that. We'd also suggest that you start with one program to begin using that data visualization tool and see if it's valuable to your organization. If you are you have a more rigorous system in place already, you already have something in place, then we would suggest that what you do is you review the tool to see whether you have those same types of key pieces of information readily accessible to you within your data system, and see if you can filter some of your outcomes, some of your utilization information on these key demographics within the tool that you already have. We would also suggest that based on these kind of two components together, that you really think about within your work group, identify one area of concern that you want to address, whether that's an outcome disparity, how you're doing on a particular vulnerable population, service and outcomes, a data gap, perhaps an organizational inequity, and really think about which one of those would you want to address within your work group, and have your work group think about who and how you would set up a work group or a committee to discuss what to do for that issue. So the takeaway is just think of an area of concern and think about how you would start to gather the right folks to begin to address it. And those are the next steps that we would suggest. Last thing I have here, I'm waiting still to see if anyone has questions. Please chat them in. We have a couple moments. After this webinar, you'll be receiving some information shortly about our end of semester 1 evaluation. Please complete that survey. Right now, if you have a moment, we would really appreciate if you would go into the chat box and click on our feedback survey. It's just about the last 2 webinars. It should take you less than 90 seconds, maybe 2 minutes if you're thorough. Could take as short as 30 seconds if you want, so, but we really appreciate your feedback. So also, please register individually for the June events. The dates and locations are posted there for you, and please make sure that you register for those so we can plan for your attendance. We will also be sending out a bit of an agenda for those so you know what we'll be covering, so you can decide which parts of your work group would be best represented there. Semester 2, we'll definitely be sending out additional information about those webinars, but just so that you have them available to get on your calendar, so you can plan your vacations around the PDA, of course. Those are listed for you there. They'll obviously be recorded, so you don't have to plan your vacations around us, but just in case you wanted to. All right, that is all that we have for you today. It does not look like any questions came in. If you do have any questions, we'll sit here for a couple of moments, and you can always email us at pda@ccsi.org. There are no further questions that have come in, so with that, I suppose we will wish you a happy afternoon, and we look forward to seeing you in June.